So good morning, everybody. I'm Jessie Whittish with Kentucky Youth Advocates, and thank you all for joining us this morning, whether this is your first Advocate Virtual Forum or you have joined us for weeks. As I said, it's good to see all of you this morning. Just a heads up that this forum is going to be recorded to share later as a video, and then we are also going to share it as a podcast. The panelist conversation we will share as a podcast as well. So please, if you if you're joining us today and you want to spread this information, please share those recordings. We really appreciate the questions that you all submitted in advance, and we're incorporating some of those questions into the questions we're asking panelists. But please feel free to put in additional questions or comments or whatever in the chat feature. And if we don't get to those, we're going to have another forum around like parents returning to work. So we may incorporate those into that. Or that can be just useful information and questions to have in terms of advancing advocacy work in this arena. So please feel free to use that chat feature a lot, even as folks are talking. So I'm going to now turn it over to Terry Brooks, who is going to kind of kick us off for the day. And Terry, here's to you.
Okay, thanks, Jessie. 3 points. One is I saw someone who said something about 2 cups of coffee. Such an amateur. See this thermos? This is my 3rd thermos of the day. So I just want to like that. So I also would be negligent if I didn't, as we always do, say thanks for joining today. I know despite this new reality, folks have really busy schedules. We love the routine of this. We especially love folks who are joining from other sectors. You know, our hypothesis is always that we got to have child welfare and juvenile justice folks thinking about child care, just like we have to have child care folks thinking about economic well-being and juvenile justice. So that's really important. I have to tell you, though, I want to tackle a 3rd issue. My supposition is that we could not even begin the important discussion around the issue of reopening early childhood today if we don't address another issue which surely is on everybody's mind, or should be on everybody's mind. And I want to be clear. I'm a white person whose family has been richly blessed. And that means that while I can empathize with, I can never fully understand what my brothers and sisters of color have felt for centuries. You can call it discrimination or prejudice or institutional racism or our national sin. But I'm not about to act as if I understand, truly understand the burden of racism. I also want to be clear that I've never been a policeman. And that means that I do not know and I have not felt the pressures, the fear, the danger that law enforcement professionals feel every day, in every way, on every run they make. Now, with those 2 caveats of ambiguity aside, what I can tell you is that I and every fiber of KYA as an organization are serious when we assert a vision to make Kentucky the best place in America to be young. And we know that vision will remain elusive as long as a child's skin color still shapes their opportunity to thrive. And that's still true in Kentucky. As tragic as the headlines that we've all been reading, both nationally and within the Louisville context specifically, maybe we shouldn't get lost in the moment, but maybe we as a people can at long last confront the systemic racism that maims and harms and literally kills Americans of color. You know, systemic racism, as we know, touches every aspect of what it means for a little boy or a little girl of color to grow up in Kentucky. Health outcomes and educational achievement, safety and child welfare, economic viability and family stability. Those all, the potential of all that gets robbed with racism every day and in every way. So I know that the folks on this call, or you wouldn't be on this call, want every kid in Kentucky to grow up healthy and safe and hopeful. And I just wanted you to know that we at KYA really want to renew our dedication to the idea that we have to combat systemic racism in a variety of ways, but our particular beat is through policy advocacy. I am totally convinced that this gives us an opportunity to forward an equity agenda in Frankfurt that has been lagging for far too long. And our intent is to use these tragedies as catalysts for positive futures. I don't know about you, but I have read a million op-eds, and in general, I'm not impressed with any of them because they're either this side or they're that side, and very few hit what I think is principles and pragmatism. The one that stood out to me was from Kareem Abdul-Jabbar. He wrote it in the Los Angeles Times over the weekend. If you have not read it, you should. He was able to make everyone mad and inspire everyone in just a single op-ed. I love the way he closed it. Racism in America is like dust in the air. It seems invisible, even if you're choking on it, until you let the sun in. And then you see it's everywhere. As long as we keep shining that light, we have a chance of cleaning it wherever it lands. But we have to stay vigilant because it's always still in the air. I just want to invite you to join KYA to do our part to clean the air in the Commonwealth and across the nation from the stench of racism for the future and for the present of each and every child that you serve and that we all serve. So I appreciate you indulging me. You know, I felt like that was an elephant in the room that if we don't talk about it, we either look cynical, naive, or out of touch. So I just wanted to kind of talk to you from my heart this morning. And I appreciate you indulging me. The rest of the conversation is going to be about reopening and childcare. And to help us facilitate that is Patricia Tennen, KYA COO. So Patricia, the platform is yours.
Thank you, Terry. And thank you for setting that stage and addressing that. That was really powerful. So let's now shift to the topic of reopening childcare. I'm really excited to have this discussion with all of you. We have an excellent panel today representing east to west and in between. And so to jump right in, I'm going to quickly introduce our panel. So first is Dr. Sarah Vanover. She's been working in the field of early childhood education for over 22 years. And she's had the opportunity to be a teacher, a director, and a trainer for other early childhood educators. So a huge wealth of experience that she brings. She's also a professor at EKU, where she's taught early childhood educators. And she is currently the director of the Division of Childcare in Frankfurt. Alongside Sarah, we have June Widman. June is the executive director and one of the founders of the Eastern Kentucky Child Care Coalition, which is based in Berea and founded in 1990 to assist communities in promoting quality childcare. June's organization is in the middle of a transformation and is going to become the Appalachian Early Childhood Network and moving its home to Hazard to support quality, affordable early care and education for families in Appalachia. So welcome, June. Also on our panel, we have Travis Burton. He's the Director of Political Affairs at the Kentucky Chamber of Commerce, where he leads the organization's policy work on education and workforce issues. Before working at the Chamber, he was the Director of Public Relations at the Department of Agriculture, and he's also worked as a policy advisor in leadership offices in the Legislative Research Commission, and he hails from Garrett County. And finally, we have Jennifer Washburn, who's representing far Western Kentucky. She's the owner of and executive director of iKids Childhood Enrichment Center, which is a 5-star NACCE accredited center in Benton, Kentucky, which just celebrated its 21st anniversary. Since March of this year, iKids has operated as a limited duration center, partnering with Marshall County Hospital to care for healthcare employees and emergency responders. And Jennifer is incredibly active in her community and a super advocate for early childhood, and was also recently featured in a New York Times article. And so we are very pleased to have her with us today as well. Welcome to all of you. So to get us started, I have invited Dr. Vanover to set the stage for us and give us a sense of the state of childcare at this current time. As you all might know, the Cabinet recently announced the new guidelines for childcare centers to reopen, with family childcare homes set to open June 8th and licensed childcare providers on June 15th. And Dr. Vanover, I know that you have spent a lot of time, countless hours explaining the reopening guidelines, listening to feedback from childcare providers and advocates, and answering countless questions. And so we are so appreciative of all the phenomenal work and leadership you've been doing, and know you've really tackled it with your whole heart and brain. And while we don't have time today to go into the guidelines in depth, knowing this is a cross-sector group of advocates, and I know you all know very well the value of childcare and the fundamental role it plays. So I've asked Dr. Vanover to take, 10 minutes to give us a sense of kind of the 30,000 view of the state of childcare in Kentucky, and how it's being impacted by COVID, and what we can expect with reopening. So, Dr. Vanover, I'll turn it to you.
Thank you very much, Patricia. So there's a couple things that I want to say about COVID-19. So in Kentucky, we have over 2,200 child care programs, and that includes licensed centers and family child care homes. I say 2,200, that was prior to COVID-19 that we had those programs. That included slots for over 165,000 children. And that seems like a great number. But we also know that out of our 120 counties in the state of Kentucky, 65 counties are considered child care deserts. And they do not have enough child care for the working families that live in that community. So we were starting this pandemic, this challenge already behind, basically. Out of 165,000 slots for childcare, we know that we have 28,000 children that receive childcare subsidy, and that makes about 17%. So 83% of the children that can attend childcare in the state of Kentucky, their parents are paying for that out of pocket. Myself being one of them. I have 2 children that go to after school programs every day, and I could not be a full-time working mom without that. But again, it's a huge expense. When I had an infant and a toddler, it was much more than my mortgage to pay for my child care. So we had some challenging dynamics to begin with. And one of the greatest challenges we had prior to COVID-19 was staffing. We had a staffing crisis throughout the state because childcare wages are so low. Many centers pay minimum wage, and we're asking so much of our child care providers. We did not have the staffing that we needed to maintain child care throughout the state. Many centers had rooms sitting open because they could not hire the staff that they needed to care for the children who needed child care. So a lot of programs had wait lists. Moving into COVID-19, child care programs shut down on Friday, March 20th. And at that point in time, over 2,200 programs shut down. Limited duration centers were authorized through the Division of Regulated Child Care, and that's a fancy way of saying emergency child care. We had around 80 of those programs that opened up, and their sole mission was to care for children of essential employees, so that our hospital staff, our emergency responders, our frontline DCBS workers, our grocers, people that just were essential to the state functioning, had emergency childcare that they needed. And Jennifer can elaborate more on that as one of our limited duration centers. But those programs, those 80 childcare programs, offered slots. About 1,800 children took advantage of that. 80 programs with 2,200, we had about 3.5% of our typical childcare open throughout that state. And what is surprising is that most of those programs had such low enrollment that the state had to help support them with money from the CARES Act, because enrollment was so low that our limited duration programs were hemorrhaging money. Many of those programs, if parents had an alternative, they were finding an alternative to place their children somewhere else. If there was another parent or caregiver that could stay at home with the children, then they were utilizing that. And so many of our families took the healthy at home very seriously, and only the children that really needed care were in care. So during the closure, we received $67.7 million from the Federal CARES Act, which was a huge blessing. It was fabulous reinforcement. And we sat down in my department and my cabinet, and we brainstormed the best way to get that out to the providers, because we were still paying subsidy for the children who are enrolled in subsidy. We did that based on enrollment and not attendance, so that programs would have some funding to pay their fixed expenses. But that was only for 17% of the children for the capacity of the state. So many programs were receiving nothing. So we got that $67.74 million. And the first thing that we did was we took 60% of that money, and we said, we are going to give every provider $225 per capacity slot that they have. So if they were licensed for 200 children, and they got $225 per child, then that was going to be a good chunk of money. And we thought, oh, I was so excited. I was thrilled. I was like, I get to tell all these people to send them money. I'm so excited. This will be such a blessing. And Jennifer's nodding her head. I actually talked to her and I was like, I'm so thrilled. And when we sent these funds out, many providers emailed me back and they said, this is great, but this is 1 week of revenue. That's it. It's 1 week of revenue. And the closure has been 10 weeks, over 10 weeks now. And there are fixed expenses that every child care program has for their mortgage or rent, their utilities, their insurance premiums, both for their property and for their employees' health insurance, if they offer that. And then staff salaries, if they're still paying them or attempting to even pay them something. But the CARES Act helped us to at least help them pay their fixed expenses. And many of their staff were laid off and put on unemployment. So between those two things, they have maintained this closure with the CARES Act money to pay their fixed expenses and unemployment to pay their staff. And LDCs, like Jennifer's program, got an additional stipend from us to help with some of that financial hemorrhaging. But they also got the sustainment stipend too. So along with that and the small amount of revenue they were getting, okay, I think that we're getting most of these 2,200 programs through the closures. Now comes the point where childcare is going to reopen. June 8th, we're reopening family childcare homes, which are smaller environments, so it's a good place to begin. And then June 15th, we're reopening center-based childcare. There are a lot of new restrictions. And it was this balancing act, and it was tedious. And let me tell you, I stayed up at night and I thought about it so much. How do we keep our child care programs open? And many of the people that sat down at the table, Department of Public Health, Division of Regulated Child Care, our coaches through Child Care Aware, when we sat down to think about best practice, we had to really balance healthy and safe for our children and staff and enough revenue to keep programs from collapsing immediately. And so some of the regulations coming out include maximum group size per child of 10 children in a group plus their teachers, limiting the number of adults that will be with those children, not allowing visitors into the building, making sure that all staff wear masks. There's a lot of procedures, increasing our health and safety, our cleaning, our sanitizing a great deal. During this process, though, if you had a classroom of 20 preschoolers, and it's now limited to a maximum group size of 10, that has a significant impact on your capacity and your revenue. Our infant toddler programs, they were smaller class sizes anyway, so this may affect 10 to 20% of their capacity. But most centers lose money on infant and toddler care because the adult to child ratio is so small. You know, one adult may care for 4 to 5 infants. So it's not a moneymaker. Preschool is where most centers make their money. And now one adult could typically be left alone with 10 children or even up to 15 children in school age, anywhere in that range, depending on their accreditation and their licensing numbers and age groups. But now we're taking those classrooms of 20, 25, 30, we're saying a maximum group size of 10. And so they're losing anywhere from 50 to 60% of their preschool revenue. Now, we have made some additions, things like allowing for temporary walls to be put up in classrooms so that that classroom could technically divide the children up to keep more of those children, to keep more revenue, but still keeping children in the same group of 10 all day so that they're not exposed to additional germs. And so we're trying really hard to work with our child care providers. We're giving them an additional stipend to pay for cleaning and PPE and for temporary walls if they're going to put those up, dividers in the classroom. But we do see a significant upcoming impact on capacity. Now, what we don't know yet is how many programs are going to reopen. The National Association for the Education of Young Children is predicting up to 40% of our child care programs nationwide could close during the first 6 months. We have a great interest in our programs reopening, but some of them are delaying that reopen because they can't get enough staff back just yet. Child care providers make such minimal wages that being on unemployment with this extra $600, man, it's a good place to be. You might not get that much money working full time and exerting a lot of hard work, which just shows how badly we need to increase child care provider wages. It's not saying that we should take away money from unemployment. It's saying that child care providers need to be paid more and respected more. But many programs are worried about bringing their people back, getting enough staff to reopen, getting the PPE they need, the cleaning supplies, the masks, the gloves. If you're doing diaper changes or feeding babies bottles right now in these very turbulent times with a lot of illness, then you want to make sure that the right protective equipment is in place, and our providers are having a hard time tracking that down in some areas. And they're also really scared about their financial stability. The off-ramp for closing childcare happened really quick. March 20th, we said everybody closes. Whoosh, everybody's off the highway. Centers close down, and we have those 80 programs that reopen. The on-ramp for getting back to stable childcare is going to take us at least the next year. It's going to be a very slow process. Many parents have already made alternative plans for the summer. They don't know how this regrouping is going to go, so they're looking at individualized childcare or a babysitter to stay at home with their children, and then they're thinking about, okay, August or September, I'll put my child back in group childcare. Others are saying, I'm waiting till there's a vaccine. I'm not going back to group childcare right now because I don't know what the implications are for my child. Others are saying, I need childcare right now, but my provider only has 20% interest out of their typical enrollment, and they can't reopen. And then we also have the scenario, particularly for our LDCs who have not had a maximum capacity. They might have been enrolling at maximum capacity as an LDC, but as they transfer back to a licensed program, they're going to have to ask families to leave. Because that group size of 10 may impact them. So those families are looking for alternative childcare now because they may not be able to stay where they have been located. So there's so many scenarios right now on what's going to happen, on what's coming forward. Our programs that operate on the school year and are closed for the summer, they've got a little more time to think about it. After school programs, programs that typically don't open up until August and close in May and open in August. But our year-round childcare programs are making a lot of decisions right now. They're saying, can I open on June 15th? Do I need a few weeks to wait to put up temporary walls and to get my PPE, or do I need to wait 2 or 3 months and see if I can get more enrollment back up? Can I reopen at all? And so this is going to be a really tedious time for us. A lot of programs want to reopen, but these first 3 months, 6 months, and up to 12 months are going to be a telltale sign of whether or not they can survive. We look a lot at financial bailouts. One of the big financial bailouts we hear a lot about is the airline industry. When the federal government bails out the airline industry, they're not looking at those first 3 months, how many people are in each seat. If there are empty seats, they're not counting them one by one. They're just saying, we have to keep the planes flying. We have to keep the planes flying because if the airlines collapse, what are we going to do in 1 year, 2 year, 3 years when there are no planes? Childcare, though, we have this tendency to count kids person by person. So in a bailout situation, a lot of times we're saying, but this childcare center only has 20 kids in it and they have a capacity of 100. We can't pay for this center to be open if there's so many empty slots. But the problem is that in 3 months, 6 months, 12 months, and multiple years down the road, we have to have the childcare program in place in Kentucky. Otherwise, families are going to take a huge hit and will not be able to return to work. So right now, getting funding and keeping our child care programs open is going to be a huge piece. The CARES money has been awesome, but our child care programs are just not stable moving forward right now. They want to reopen, but how much revenue they can get in, 85% of their funding goes to pay staff. Staff is the #1 expense, because really as a parent, when I'm shopping for childcare, I'm shopping for human capital, the people that are going to care for my kids. That's what I'm buying, is my children's time with these wonderful providers. And that's the major funding source. So we've got to find a way to keep those providers there so that parents want to enroll and the centers can stay open long term. And the biggest barriers that we're looking at are those staffing, that stability, and access to the materials that they need. Now, one thing that we're doing right now before childcare providers can reopen, we have put together a mandatory training to refresh everybody on their cleaning and sanitation processes, but also to remind them about being a mandatory reporter. During the past 10 weeks, 11 weeks, depending on public school, things like that, child care abuse reports have gone down because eyes are not on these kids. Families have been in their homes in very stressful situations. My husband and I were lucky enough to keep our jobs and have income, but it was still very stressful to be together without a break all the time with me and my kids and my husband. And other families had much more high-risk circumstances than we did. And so as those families begin to leave their homes and childcare providers have their eyes on them again, then we need to remind those families about what mandatory reporting and their obligation and what to look for. So all of our childcare providers are going to get a refresher course on that, so that children who may have been exposed to stressful circumstances, we can watch that now and give those families the support they need instead of waiting until the situation escalates too far. And that's kind of where we are right now. We are looking at that reopen this month. We do have centers that are delaying. And we're trying to give all the support that we can to our child care programs to reopen, to help families, to help them in the workforce, and to keep those programs as clean and sanitary as possible so that when our children re-enter, they're in a safe environment. I will say I'm so proud of our limited duration child care centers, because no child and no staff member was diagnosed with COVID-19 during the time that the regular child care programs were closed. And that's a great accomplishment. Many of those were attached to hospitals, and they had additional policies that were put in place. And now we're moving forward with our licensed, certified, and registered programs reopening, and we have put a heavy burden on them. They have to meet all the normal requirements, but we're filing emergency regs with the governor's plan to reopen childcare, and there are new requirements that are going to be on them as far as the frequency of cleaning and these small group sizes that can only be together with the same group of 10 children, like their family will stay together all day long and they won't be exposed to different groups. And we're hoping to be just as successful as the LDCs were at this point in time. So that's kind of my.
Thank you so much. I think that passion comes right through. If folks want to have questions on the particulars, what's the best place to go to find that information or to ask questions? And we can put a link in the or follow up with that.
If you go to the Healthy at Work website, you go to kycovid19.ky.gov and then scroll down to Healthy at Work. It gives you all the dates of the different businesses reopening, and you can click on childcare on June 8th or June 15th, and the whole reopen plan is listed there.
Great. Thank you so much. Now I'd like to kind of hear from our other panelists to respond to what Dr. Vanover shared. And June, if I could call on you first. I know you've always been so articulate in your advocacy for family child care providers. And it sounds like to me that I was hoping you could share with the group why this type of care is so valuable even before the pandemic, and how it is even more so now. And wondering if you see any opportunity in this to increase the supply of family child care providers and what that would take.
Sure. Before the pandemic, in our region of the state, we saw family child care years and years ago as a real opportunity to bring certified homes into the region, to bring some level of oversight to care that was being done in areas where that just couldn't support a larger center. So because of so many smaller places, family child care just made sense, that there was less demand in terms of a very specific area. Unfortunately, over time, those numbers just dropped. It seemed like we didn't have the same supports in place that we did originally when family child care was first happening in the state of Kentucky. The small family child care home was created specifically to be able to serve 6 or fewer kids plus a few related children, you know, to really make sense for one person in terms of adequately caring for our young children. So when we look at it now, and just for a point of reference for those of you that don't know, at one point in time we had over 1,200 small family certified homes in the state of Kentucky, and now it's less than 250. And unfortunately dropping. I just got a call right before this meeting from a provider who called to tell me she wasn't going to be opening back up due to her own health issues. So when we look at the how does it fit into the picture now, Sarah mentioned a couple of things. First of all, a small family child care home is caring for a smaller number of children, and often related kids, often sibling groups. So right away, you've already reduced the numbers of homes with different germs coming into the scene. So there is you know, with a limit of 6 to 10 kids, you've already limited the amount of spread of anything that could happen. And just thinking about the day, there's less disruption to what a schedule would typically be, because you're not having to think about your group going out on the playground at a certain time, or your group passing through a hallway or whatever. You're naturally got that smaller number with 1 to 2 caregivers, and so you've already got a lot of things in place that have been recommended in terms of safety. You can have an easier time of designating seating for meals. Kids can have their place at the table, and so again, less cross-contamination going on when your 6-foot distancing might not be as possible. You also, because you're dealing with less families, you can work to stagger pickup and drop-off times so that there's less chance of folks being in proximity when they shouldn't be. So all of those things kind of lead to, you know, fitting right in with the guidance and without quite as much difficulty. But that doesn't mean it's going to be easy. Kind of the other side of that is that even though it's limited numbers, you're still inviting outside germs into your home. You're bringing that into your residence, not just your place of business. And so it's a consideration for your other family members in terms of, what am I exposing them to? Is there an elderly member in the family? Do I have an infant? You know, what's the situation there? And then many of the family child care providers who are currently certified or licensed are in that older category in terms of their own risk to themselves and their own health. And so they've got to think about that. And then one of the providers mentioned to me about, you know, something she'll have to regulate and know that she'll miss is that her parents' opportunity to speak with each other, you know, to take that little time when they're picking up their children to be able to compare notes, you know, to ask how they're handling something or whatever. So just that little bit of socialization among parents of younger children, they're going to be missing out on. And then, of course, the one where wearing the mask, that's just going to be such a tough thing. And knowing that children respond to facial expressions, et cetera. I know it's not an impossibility, but it certainly isn't going to be anything easy. For licensed homes that have been able to take care of up to 12 children in the past, I think, Sarah, you mentioned it with the the centers that have to, you know, reduce by a couple of kids, that's going to be a tough thing for them as well. It's like, what two aren't going to be able to come back to my program? And again, with that smaller number, many of these providers have been caring for children birth on through the age spectrum. And so it's particularly difficult. And then there is a general fear, and I've heard this from both family child care and centers, and it's the fear of licensing. Okay, it's that, you know, you're already used to what you have to do to maintain all the regulations, and so now this new set takes competent people and makes them fearful. You know, it's like, what's going to happen if I get, if it's not, I'm not meeting all the guidance all the time, am I going to get shut back down? And so I think that's, you know, something that, again, some messaging can really help, some kind of support for, you know, this is not an easy thing. As long as you're making an effort, let's see what we can do to make it better. You know, that sort of thing can happen, but not to ignore the fact that the real fear is there. I think when we look in terms of, you know, why aren't there more folks jumping in right now then and becoming family child care providers? There's some real effort to put that word out that this is a thing. You know, when even just yesterday, hearing folks hear about family child care, they immediately assume it's not regulated to the same degree. There are some real misconceptions about what it means to be a certified family child care provider or a licensed family child care provider. People assume because that business is in your home, it's not regulated, or it's not regulated to the same degree. So there's a lot of work, I think, that needs to be done around messaging and about how this is a viable profession, especially for someone with young children of their own. But again, at this time, when you're also having to weigh that with the health risk, it gets a little more difficult to see. One of the other issues or barriers that has been in place for some time now, especially affecting our region of the state, we have a large number of families that could qualify for assistance in paying for childcare. One of the things that affects both centers and family child care providers is that their rate of reimbursement is too low. When I look at some of the numbers and I see that the 5 counties with the lowest rates of reimbursement are in either Eastern Kentucky or Northeastern Kentucky, those programs, the infant toddler rate is about 70% of what your folks in Louisville or the Bluegrass area are receiving. And it's really hard for me to think that our folks coming to work every day in child care programs and providing the same level of care are only worth 70% of folks in our neighboring counties. But the other impact that has is that when a program charges a rate that, you know, they've found to be reasonable, so if they're charging a reasonable rate for infants, but the state pay is, you know, only meeting a smaller portion of that, a person whose income qualifies them for 100% of, you know, child care assistance payment rate still has to come up with money out of pocket because their child is in that center in that county or in that home in that county. I looked at the difference. A really striking one is between Powell County and Clark County. They're neighboring counties, but because of, you know, that imaginary line that divides them as counties, the person who's taking their child to a program in Powell County is going to have to pay out of pocket. You know, if the 2 programs, one in each county, were charging the exact same thing, because of the reimbursement rate, a person would end up having to pay out of pocket a bit more to have their child be in a program in Powell County. This has to be addressed, and until we can figure out a way to do it, this is, you know, it's going to take something more major to really look at the inequity here. It's really hard to look at the way we're confined to using the market rate right now, creates reimbursement rates based on tiny markets, okay, based on counties that have one program or two or whatever. It's hard to attract folks, it's hard to say, come into the field, when 50% of our folks might qualify for payment assistance, but then it's really hard for you to charge more than, what's going to be helpful for them. It's hard to attract folks into the field when that's our situation. How do we attract more players into the market when the rate is so low? How do we keep demanding more and more but pay so little? This is not a slam on how Kentucky uses its money. This is really a call to say, until we figure out how to put resources into the field in general, we're never going to find the equity that we need. Up to this point, childcare has existed because, frankly, women have been willing to work for so little money. And this unfair situation can't continue while the expectations of those folks are constantly on the rise. We expect so much and we pay so little. So until we can find those resources to really develop a solid infrastructure for childcare in our communities that reflect what our communities need, until we increase state and federal investments in early childhood programs, and work towards fair compensation, as Sarah mentioned, we're going to continue to struggle, and we're going to continue to not be able to meet the true demand that's out there.
Thank you, June. Yes, well put, and I so appreciate your ongoing advocacy on this topic for many, many years. To me, it tells me the value of why you need a network to speak together. Thank you for that. Travis, I'd like to now turn to you because we know that childcare is a critical piece of the economy. And as businesses are reopening, we all thought, well, that's kind of funny that they reopen before childcare does. So we know this has to be a barrier for employers, and for employees and employers, and wonder if you could tell us what are employers in Kentucky doing, and how are they being supportive of childcare centers, or what kind of solutions are they looking at being part of?
Sure, and I'm so excited to be here today. It's certainly a challenging time. One of the things we know is that even before the pandemics, this pandemic started, access to childcare was becoming one of the most talked about barriers to getting individuals into the workforce, qualified individuals. So, and listening to June's remarks, I remember, we spent the last couple of years talking about how do we improve how can we help improve the profession and what we invest in the profession so that we can improve access, not just to childcare, but to quality childcare and quality learning environments. And gee whiz, I miss those days where that was kind of our number one focus. And now we've been shifted into just having to discuss how do we make sure that we can have enough childcare to support the workforce as we begin to reopen the economy. So employers are scared and are very nervous. We conducted a survey, and I think around probably between 70 and 75% of respondents. And again, that was not a scientific poll. That was just something that was put out by us and to our membership, and probably put out by some others as well. But that we, with that high of a number of concern, I mean, it's something that businesses are taking very seriously, and it's going to be an obstacle. They know it's going to be an obstacle. And as they're planning to open their doors and bring people back in, and that's starting to happen, it's already proving to be an obstacle. So one of the things, in our conversations with businesses across the state it's really all over the table. First off, businesses, they're not prepared, they're not qualified to provide childcare themselves. In trying to be creative and in trying to keep the wheels moving, some businesses have looked and tried to think outside the box. They've tried to pull their resources together to offer childcare to think about offering childcare on site or childcare nearby. Obviously, they're very concerned about the statistics we're hearing and what we're hearing from the provider community, that there's going to be such a challenge in reopening their doors. If we were to lose, we already have childcare deserts present in Kentucky, and if we lose 40% of those that already exist, expanding the borders of those deserts is very concerning to businesses everywhere. And so one of the things we've done at the Chamber, we worked with KYA and appreciate them taking such an aggressive role in talking with our federal delegation to make sure that every member of the federal delegation understands how important this issue is and what a key component it is to having a functioning workforce. We are working with the U.S. Chamber to advocate on Capitol Hill that in any future conversations with relief, that childcare be included and that relief to providers be included. We need the providers there. We need them to be successful, and we know that that's such a challenge. We are, we're hearing conversations of, we talked about family childcare. There's a possibility in some areas of the state we're going to see employers take a closer look at that, take a closer look at how can they incentivize family and home care. How can they work directly with those who provide family care to help just make sure that their employees that need access have some form of access if there's no providers or childcare facilities nearby. So we're starting to hear more of those conversations, and we are, I think that the goal and the hope is that we can see most of our providers reopen and that we can get back to having that conversation of how do we provide as much access to quality learning environments as possible.
Great. Thank you, Travis. Jennifer, I'd like to turn to you now and ask, as a childcare provider, I'm curious to hear, what concerns are you hearing from parents? And as an emergency provider, do you anticipate on June 15th that the parents are going to be coming back? And I know from my experience when my kids were toddlers that my childcare provider, they were so helpful in helping me understand their developmental needs, from toileting to, sleep, napping. And I wonder, as children are returning to centers, we know they're likely bringing with them these potential trauma they experienced due to this crisis, and it's going to be a transition of its own. And I'm wondering, as a provider, how are you thinking through that? And do providers have a unique role to play in providing that social and emotional support for families?
Absolutely.
And what does that look like?
Absolutely. First, I want to say this is so beautifully exciting for me, because in 21 years, I would have never imagined that it would take a pandemic for all of us to come together and to be united. I feel like for many years, we've operated in silos, and especially childcare providers, because we use that silo as a way to protect ourselves and to protect our business model, because honestly, they're in direct competition with one another. And this has forced all of us to come together to work with Division of Regulated Childcare and DCC to be our advocates in this too, and then to learn how to have that advocate voice. And so I do want to thank Miss Dr. Vanover for everything she summarized, because it's wonderful to hear that she gets it. And so often we as providers feel like they just don't hear us. And then for Miss June to be able to articulate so wonderfully the exact thing she said as a family care provider, licensed providers are feeling the same things, that the incongruence of rates of reimbursement, and the love of our families and wanting to bring them in, and looking at, gosh, how do we mitigate this loss of numbers of children, knowing that our families are already struggling with maybe the rates that we had before. And we're going to have to look financially on how to fix that gap. And that might come with some rate increases for some. So providers are currently wrestling with the business part. How do we manage that business part of being a provider to our families? And the part we love, how do we be a support to our families with those social emotional things that you did describe? And we've been asked in some of these very appropriate and important guidelines in order to mitigate the spread of these viruses. The requests made of us make complete sense. The requests made of us of limiting sizes at this moment and watching how many people come into our space, absolutely, they make sense from a health perspective. How do we do that is some of that challenge. But how do we do that and still support the social emotional needs of the family? So, for example, one of the requests is either a central drop-off location so that families aren't entering into this space. And prior to COVID-19, in our space, we loved that families walked down the hallways. We loved that they saw each other as they passed and could have conversation, because that is so important, that sense of community. We absolutely loved and cherished that they would stop and talk to their teacher. That's one of the things that childcare is able to do that elementary schools, they stop. They do drive-through drop-off. And I would go, that is so not us. Now I'm going, how do we work through that and support that expected requirements, but still support that social emotional part of attachment? Because if you have an 18-month-old and you're bringing them up, and normally the parent would try to slowly filter them into the classroom, now you're doing it either in a holding space so that the parent doesn't, or you're doing it from your car to the front door. And so how do we support the mom who walks away, or the dad or the caregiver who walks away very sad because we've had to take that very sad friend as they come to us? And so we've been trying to work outside the box. We're all getting really good at this outside the box. And so I'm going to change it to outside the silo. How do we share the practices that we're coming up with that may be creative? And so some of those things include making videos of our space, because children who were with us, who've left us for, at this point when we reopen, it will be 12 weeks, they will expect to return to the space that was there before. They developmentally will expect to come in and see their cubby and their artwork and their face on the back of their chair and their identifying information. They're going to expect that. We're going to have some changes. And so we've been videoing and doing preschool tours. It's a different frame to do that, because these tours are for the children, not for a prospective person coming into your space. It's for your children. We've also been trying to approach it as a grand reopening. Remember, our appearance and the way that we welcome people speaks volumes. Well, we're going to be welcoming them like this. So that's a little bit of a challenge. So our body becomes the welcome. Our space, the signage that we use to say welcome back, the way that we prepare them before they come into our space says welcome back. And that's part of that marketing that not a lot of us are very good at. And so I want to definitely say thank you to all of these webinars that have been out there, because one of the great things the Chamber did recently was discuss how do we help reach out to other businesses to say, hey, this is a possibility, not for an exclusive partnership, but for a discussion on how we can support each other. Not a lot of us have thought that way. We're still in that survival mode. Talking with some of our local resource and referral people, as well as our colleges, and talking with them about social emotional support. How do we make our space ready so that it is welcoming and happy? And what are some things we do prior to opening to prepare our families as they enter in? And then once we do open, how do we fill that gap of parent communication? Remember, we're trying to shift from just spitting out communication to engaging them in our practice. So how can we use Zoom to become some of those places for networking for parents? I know parent cafes are happening using the strengthening factors approach. Those are still currently going on. How can we tap into some of those resources? Providers right now, though, I'll be real honest, we're on the operating table. We are in surgery and we are the patient, and we are praying we come out of surgery okay right now. CARES dollars have been very helpful while we're in surgery. Sarah explained that perfectly. Some providers were able to access PPP dollars, not very many, and that was helpful to those spaces as long as they can meet the requirements as currently stated for loan forgiveness. That's been helpful too, but these are all things that are helpful while we're in surgery. The conversation will be shifting soon and sounds to be shifting to what happens while we're in recovery. Remember, the recovery room isn't long-term sustainability. And I think that this entire COVID has exposed painfully what we've all been trying to make work for many, many years. And why do we want to make it work? Because we are passionate about our children, we're passionate about our families, and we have this mission to work together on that. And it's so exciting for me to see so many people coming together represented at this table.
Well said. Thank you so much, Jennifer. Clearly, you have a bright spot there in Western Kentucky, and I'm very grateful for your advocacy. And now I know I want to be cognizant that we have 1 minute left and invite my colleague, Ben Gies. If you could wrap us up with some closing comments and a call to action.
Absolutely. Well, first, I want to thank everyone on the call today, and I especially wanted to thank all of our panelists. I love the fact that we have the whole of the Commonwealth of Kentucky represented today by such bright, intriguing, and clearly motivated individuals. So thank you all so very much. Our call to action is this, as Mr. Burton of the Kentucky Chamber alluded to in his discussion. Kentucky Youth Advocates and our partners across nonprofit advocacy, we have been advocating for some time now with our federal delegation to invest a total of $50 billion, and yes, that is billion with a B, $50 billion into federal Child Care Development Block Grant, or CCDBG funding. And we have not heard from a single member of the U.S. Congress representing the Commonwealth of Kentucky that what we're asking for is out of pale or not needed. But now that call to action falls on us as citizens. So what we're asking you to do is whether you are represented by John Yarmouth in Louisville, or James Comer in Paducah, or Hal Rogers out in the eastern part of the state, or of course collectively by our two senators McConnell and Paul, we are urging you to contact their offices to advocate for a national investment of $50 billion in CCDBG funding in upcoming federal legislation. We have a real shot at this, but we need to make sure that all of our representatives know that we're paying attention and that we will hold them accountable for their decisions. So coming to you very soon in our follow-up email will be a call to action. It's a simple link that you can click on, and it will get you in contact with your representatives via email to stress how badly this investment in childcare is needed in Kentucky and throughout the nation. So with that, we ask that you use your voice as a citizen to advocate for this need. And again, we want to thank you all very, very much for joining us today. We appreciate it so much.